For a lot of patients who are faced with breast cancer, this is a really scary experience. And for many of them, they'll opt to have a mastectomy on the side of the cancer, which we know is equivalent to breast-conserving surgery. Many of them will ask about their contralateral risk, the risk of developing cancer on the other side, and whether they should have a mastectomy on the other side to maximally reduce their risk. For many patients, this is actually a really good option because they know that even without having a genetic predisposition, that is to say, a mutation in BRCA1 or 2, or a mutation in any number of the other genes that we now know about because we're doing large panel testing, that we can reduce your risk of developing breast cancer on that side by 95 to 97%. We also have newer reconstructive techniques now, so it's no longer disfiguring, and for many patients they'll appreciate the fact that they can have both sides done at the same time in the same operative setting and have symmetrical cosmetic results. And for many patients it also reduces their anxiety of having to get mammograms and MRIs every year. What can patients expect? It's a bigger operative procedure, and they need to know that, for some patients, this may not actually translate into improved survival. It does reduce your risk of getting a contralateral breast cancer because we remove the vast majority of the breast tissue. It does not reduce it to zero. It does have a slightly higher risk of complications and a longer operative time as well as time in hospital, but for some patients, it's worth the payoff that they now have peace of mind. And I think that that's important to understand from the patient's perspective. So for patients, I would say, if you're thinking about this, have an open and honest conversation with your doctor. Learn about the advantages and disadvantages and see if it's right for you.